Hello guys, welcome everyone to my YouTube channel. This is Kingsley Joshua Rajan. So in this video what we are going to discuss about the detailed structure of human heart anatomy and the introduction of human anatomy. See, the heart anatomy is a very big chapter. So it has many features and many structures in that heart. So I am keeping this heart anatomy as a series. So I am making a playlist of this heart anatomy so that you can everyone benefited by seeing the video structures. Okay, let's see the part 1 of the human heart anatomy. That is nothing but the introduction of the human heart and with the structures and features of the heart. Okay, let's see. First, the human heart is a conical shaped organ. See, the human heart is looking like a cone shaped, right? The conical muscular organ is situated in the middle mediastinum. Okay, so it is enclosed by the pericardium. So the heart is surrounded by a pericardial layer, as you know. So the heart is lying within the pericardium. Okay, so the heart is placed obliquely. See, the heart is placed how it is obliquely placed, and it is placed behind the body of the sternum and adjoining parts of the costal cartilages. So the heart is located behind the body. So sternum before and heart behind. Okay, with the help of the costal cartilage, nothing but the ribs. That the 1/3 half is lie to the right and 2/3 is left. Okay, see, you can see the heart is bending towards the left region. So the maximum part of the heart is towards the left and the short part, the minimum part of the heart is towards the right. Okay, now see the direction of the blood flow. How the blood flow is directing towards the heart. Okay, see, this is the interior or inside surface of the heart. You can see here, right? Okay, so the blood flow is direction of the blood flow is towards from the atria to the ventricles. Similarly, in the left atrium itself, also the blood flow from the left atrium to the ventricle inside the heart. Okay, so the direction of the blood flow from atria to the ventricles downwards to the left of the medianal plane. So it is downwards. Okay, it's downwards towards the left of the medianal plane. Okay, the heart is measured 12 cm into 9 cm. That is nothing but 12 cm length and 9 cm width, and weighs about 300 grams in males and 250 grams in females. Okay, so let's see the external features of the heart. Human heart has 4 chambers, as you see, right? So you can clearly see. Okay, the human heart is of 4 chambers. That is nothing but the right atrium or right auricle and right ventricle, and left atrium or left auricle and left ventricle. Okay, so these are the 4 chambers of the heart we have. The atria lie above and behind the ventricle. Okay, the atria is above and behind the ventricle. On the surface of the heart, they are separated from ventricles by atrioventricular groove. So we are having the atrioventricular groove here, so that it separates the atria from the ventricles. Okay, the atria is separated from each other with the interventricular groove, and the ventricles are separated from each other with the help of interventricular groove. Let's see the heart. What are the parts we have in that heart? So majorly we have the 4 areas in the heart. One is the apex area. So here from the base of the near the ventricle, this is called the apex region of the heart. Okay, from above we have the base. Okay, here we have the base. So the apex region is downwards, forwards and to the left, and the base is posterior. Okay, this is the base region, it is posterior surface directed backwards. Okay, and we have the 3 surfaces. One is anterior surface or sternocostal surface, and the inferior, the inferior or diaphragmatic surface, and the left lateral. Here we have in this region we have the left lateral surface. And borders, we have the 4 borders. One is upper border in the upper region, and the inferior border in the lower region, and right border, and then left borders. So you have 4 borders and 3 surfaces. Okay, guys, let's see about the grooves and sulci. The atria are separated from the ventricle by a circular atrioventricular groove. So this is, you can see here, right? This is the atrioventricular groove which separates the atrium from the ventricles. Okay, which is divided anterior and posterior part. We have the anterior part, and behind also it running. So behind also we can see this sulcus or else atrioventricular groove. So in this groove we have the running of blood vessels here, coronary arteries and coronary sulcus you see here. Okay, so this is the atrioventricular groove as you see here. Okay, so in this atrioventricular groove we have the two parts, one is right off and the left off. In the anterior region we have the two parts, one is right off and the left off. Okay, the right off is oblique and between the right auricle and right ventricle lodging the right coronary artery. So this is the right coronary artery which is placed obliquely in the coronary sulcus or else atrioventricular groove, which separates the atrium from the ventricles. Okay, and then we are coming to the left off from the anterior region. So in the left off we have the circumflex branch. This is the circumflex branch of the left coronary artery, and in that this left half it's separating the left atrium or auricle from the left ventricle. Okay, now the coronary sulcus is overlapped anteriorly, okay, anteriorly by the ascending aorta and the pulmonary trunk. So this is the overlapping of the coronary sulcus with these two big vessels. Guys, after this atrioventricular groove we have the interventricular groove. So here we can see the anterior surface of the interventricular groove. Okay, in that area we are having the vessels of circumflex branch of the left coronary artery. Okay, so in this atrioventricular groove is nearer to the left margin of the heart. As you see here, this is the right margin, this is the left margin. This atrioventricular groove is nearer to the left margin of the heart. Similarly, we have the posterior interventricular groove. So this is the posterior coronary artery. Here we have the inferior surface or diaphragmatic surface. We have the posterior interventricular groove. It is lodging here in the inferior surface or the diaphragmatic surface of the heart. Okay, let's see the area or regions of the heart. Let's say about the apex of the heart. So the apex of the heart is lying more to the left ventricle. So it is formed entirely by the left ventricle. Okay, it is directed downwards, forwards and to the left side. It is overlapped by the anterior borders of the lung. So here we have the cardiac notch of the lungs here. So it is overlapped by the anterior border of the left lung, and it is situated in the left fifth intercostal space 9 cm lateral to the mid-sternal line. So here the sternum is like that, means it is towards lateral to the mid-sternal line. 9 cm gap we have from the sternum to the heart region, from the sternum to the apex region we have the 9 cm gap. Okay, next we are going to see the base region of the heart. Okay, so guys, this is the base region of the heart. Here we have this is the base region of the heart. Okay, so in that base of the heart, or else we can also say this is the posterior surface. It is formed by the mainly by the left atrium. So left atrium is the main part of the base, by a small part of right atrium also here we can have. Okay, this is the base region. In relation to the base, there is opening of 4 pulmonary veins which open into the left atrium. So here this is the base region. So in this base region we have the 4 pulmonary veins. 2 are here and 2 is behind from here. This is opening into the left atrium. You can see from the opening the heart. So by the opening the heart you can see this is the, here we have this side we have the 1 and 2 opening, and this side in the interior surface we have 2, and here in this side we have 2. So totally we have the 4 openings of the heart. In the right atrium we have the superior vena cava. From the top we have the superior vena cava, and behind in the bottom we have the inferior vena cava, which is ultimately opens into the right atrium. So the inferior vena cava, and above we have the superior vena cava, which ultimately open into the right atrium. So this is the base of the heart. So guys, let's see about the borders of the heart. So we have 4 borders, as I said, the upper border and the right border. Okay, the upper border and the right border, and the inferior border and the left border. So upper border is oblique. As I said before, the upper border is oblique, formed by two atria, chiefly by the left atrium. So the upper border is formed by the two atria and chiefly by the left atrium, and the right border, the vertical and formed by the right atrium, extends from IVC to the SVC. So this is the right border we have, and behind or else inferior to that we have the inferior border nearly horizontal, as you see here. So it is nearly horizontal and it formed by right ventricle IVC to the apex. This is the inferior border from IVC to the apex, and then left lateral border oblique and curvy, as you see here, the oblique and curvy region, and it formed by the left ventricle and left atrium, separates the anterior and the left surface of the heart. So okay, these are the borders of the heart we have.